Patient always have a concern about how their treatment, and if their case is complicated cases, will end up on the experience of that treatment. And TADs are one of the tools that orthodontists are using. Basically, ortho is all about efficient directional forces on a targeted area in the jaw and the teeth, and TAD is really helping to make sure that the direction of the force and the amount of the force and the kind of the point of the force is exactly targeted without causing any side effect to the other parts of the jaw and the teeth. TAD is really helpful for some complicated cases that, for example, if we need to expand the upper jaw and we want to eliminate the surgery option, or we have to move the teeth in a certain direction more than the regular movement, and if you want to kind of closing the bite once there is an open bite cases, TAD is really helpful because these type of movements mostly will be corrected by the surgery or a very long-term regular orthodontic treatment, but TAD is preventing the surgery option or long treatment for ortho. During the year, we get so busy with our daily activities, work, family, and all those social activities that we have. But in a spring break, I think everything is slowed down, and then we have more time to think about ourselves, our family. And so it's a great time to have a deeper thinking about what needs to be done for ourselves and our family. And that's why those breaks is when we get most of the patient, because everybody start thinking what they have to do and they forgot about that. TADS is always compared to regular implant, and the patient thinking about the complications, the pain, how to place the TAD or when to remove it, and it will be painful. But the reality is it works like an implant, but it's like a mini implant, and it's very, very easy to place, to remove, and once in the patient mouth nobody feels that they have some item or mini implant in their jaw. So it's very convenient, comfortable, and with no pain. There is always a misconception about orthodontic complications and the pain, and the way that me and our office we are kind of approaching that is we try to simplify this process for the patient, and we can compare the experience that they're going through with some other experiences that they already had in life, and basically it make it more sensible for them. And once they have this information, once they know the process exactly what happens next and what they should expect, it make it easier to accept it. These days, with all the complexity of our lifestyle, we are looking for something convenient and faster, to the point, less wait time, and being able to access the cutting edge technology. And I think that we all always thinking about how we can improve these elements for our patients. So we offer a convenient location, convenient hours, cutting edge technology, and then another factor is staff to patient ratio, so it helps to reduce the wait time and the patient can be seen immediately. So those are the scores that they're constantly monitoring to have a sustainable practice that we offer for the patients. All the patients, they have concern about their upper anterior teeth and how it looks like, and a lot of patients that they have gaps or upper anterior teeth are sticking out and they have an overbite. It's a very severe case, and they always feel that it's so complicated, or the treatment may be very complicated. But the reality is, with orthodontic treatment and with some treatment plans that we have, we can fix those cases easily and very quickly and the patient see the results in a very short period of time that they always thought it takes for years to do it, and it may take very comprehensive and aggressive steps to correct that situation. So technically, mostly the upper anterior teeth, the way they look and the way they position in the jaw is something that all the patient they see and they have a concern. And once it's fixed, technically they get to the comfort level of smiling and see the changes.